Extreme fiber intake can mimic irritable bowel syndrome symptoms so convincingly that people undergo expensive medical testing for a condition they don't actually have. The symptom overlap is remarkable. Urgent bowel movements, bloating, gas, cramping, and alternating diarrhea and constipation. Doctors see this presentation and reasonably suspect IBS. The symptoms are genuinely identical. Fiber-induced cramping and bloating feel exactly like IBS. Unpredictable bowel movements vary daily based on what you ate, how much water you drank, and mysterious other factors, just like IBS. Gas production is excessive and embarrassing, just like IBS. You can understand why medical professionals reach for the IBS diagnosis. This leads to medical wild goose chases. People undergo colonoscopies searching for causes of their sudden-onset IBS. They try elimination diets attempting to identify trigger foods when the actual trigger is simply too much fiber overall. They spend hundreds or thousands on functional medicine testing. Meanwhile, just reducing fiber to moderate levels would resolve everything. The physician perspective makes sense. They see classic IBS symptoms and follow appropriate diagnostic protocols. What often doesn't occur to them is asking, did you recently increase fiber from 15 grams to 60 grams daily? Patients don't realize fiber is the cause because everything they read says fiber is healthy and improves digestion. The obvious connection remains invisible to everyone involved. Unnecessary interventions follow. Doctors prescribe antispasmodics for the cramping. They recommend dietary restriction, sometimes low FODMAP diets that eliminate foods that weren't actually problems. They suggest probiotics when bacterial overgrowth from excessive fiber is the actual issue. There's a particular irony in doctors recommending more fiber for the IBS that excessive fiber caused. It happens more than you'd think. The self-diagnosis trap is real. People Google their symptoms, read about IBS, recognize everything described, and conclude they have it. They join IBS support groups. They identify as IBS patients. They don't consider that their recent fiber-maxing experiment created a temporary IBS-like state that isn't actually a chronic condition. The recovery timeline is remarkably fast for most people. Reducing fiber to moderate levels, around 25 to 30 grams daily, resolves symptoms within days to weeks. The relief of discovering nothing is actually wrong medically is enormous. Though there's often accompanying embarrassment about not connecting the obvious dots between starting fiber-maxing and developing digestive chaos. The fiber-IBS relationship is genuinely complex, though. People with actual IBS often find certain fibers worsen their symptoms, particularly inulin and high FODMAP foods. Others with IBS tolerate fiber perfectly fine. Individual responses vary dramatically, making blanket recommendations impossible. The communication importance can't be overstated. Patients need to tell doctors about dietary changes, including fiber increases. Physicians need to ask specifically about supplements and dietary trends. Better history-taking prevents unnecessary colonoscopies, eliminates expensive testing, and helps people avoid the anxiety of believing they have a chronic condition when they actually just need to eat fewer beans.